everyone. We are delighted to welcome you to our session, COVID-19 Psychological Perspectives Emerging from Policy and Research. And we have an expert panel here of a variety of folks from DePaul faculty and graduate students and alumni. And so we're going to go ahead and start it off. I'm going to introduce each panelist as they, right before they begin their presentation. And we're going to try to have about 5-minute presentations. And just to orient you to our webinar here, the camera and the microphones will only be on the presenters. And if you have a question, which we would love to have, we've set aside a good amount of time at the end to have questions and discussion and comments. And you can post those in the Q&A. So, so without further ado, we're going to go ahead and get started. Our first speaker is Dr. Leonard Jason, and he is a professor of psychology in clinical and community psychology at DePaul. And he's also the director of the Center for Community Research.
Thank you so much, Susan, and delighted to be part of this important event. I am at the Center for Community Research. We focus on teaching, research, and service here. For the past 20 years, over 270 undergraduates have gotten into graduate school and gained credentials on research projects at my center. Our research has brought in over $46 million in federal grants. And we've also been working on COVID issues with a number of things, both with individuals who basically we've been studying that have mono that we're checking out over time to see if they might have also developed COVID. But we also are working with recovery homes, and that's what I'm going to be talking about today. After treatment for substance abuse, many patients return to high-risk environments. Returning to these settings increases chances of relapse. How do we provide more than Band-Aid approaches to this issue? Well, Oxford houses are grassroots movements. They're recovery homes. Over 3,000 of them are across the country. Very exciting that they're run with no professional staff, completely democratic, and everyone has to follow these rules. No substance use, pay a fair share, which is about $100 to $130 a week, and follow the rules of the house. If you do this, you can spend the rest of your life in these recovery homes. In the current cost-conscious environment, this particular mental health innovation represents an inexpensive and potentially effective setting promoting abstinence. And this is what recovery homes look like. They're just like a house on a block, often in just your neighborhood. You won't even know that's an Oxford house. There might be 7 to 8 people living there, either all males or all females, and some houses have children in them too. And this is one of the houses. This is an Oxford house and some of the people that were inhabitants. So very specifically, I wanted to talk about our research with COVID. From March 2020 to January 2021, we had an opportunity to see what happened with COVID in terms of these recovery houses. There were over 40,000 people who lived in these houses from March to January. In that period of time, only 4 died of COVID. In our study, we looked at what happened in surrounding areas in terms of the death rates. And we found the death rates in surrounding areas were 10 times higher than in the Oxford houses, the recovery homes. We also looked at infection rates that were basically how many people got COVID. And again, the rates in the recovery homes were statistically and substantially less than the surrounding areas. And this was in 25 states in the United States. That's where the data was from. So in closing, And I'd be really interested in any people's reactions when we get to the discussion phase. What is it about recovery homes that might be protective for these most at-risk individuals? Remember, the people coming into recovery homes, most of them have had episodes of homelessness. The vast majority have been from criminal justice systems, often jail and prison. They've all had a substance use disorder. Most of them have psychiatric comorbidities and multiple chronic health conditions. With such a high-risk group, what is it about these supports that exist in all of our communities that are so economical that allows these individuals to be protected? What is it about possibly people in the house who sort of are recognizing if one person starts using, it could basically undermine the sobriety of the entire house? Maybe that same philosophy helps them protect themselves, that if one person gets sick, it could have an implication for the rest of the people in the house. So they protect themselves. They're careful. They wear face masks. They're careful about who they're allowed into the house. And we have a grant proposal that we've just submitted that hopefully will allow us to provide more answers. With that, I'm going to turn things back to Susan, and thank you so much for listening to my brief presentation.
Okay, so I'm going to, again, I'm Susan, Dr. Susan Dvorak McMahon, and I am a professor of psychology and clinical and community psychology at DePaul University. And I'm also chair of a new APA task force on violence against educators. So I'm going to be talking about educator perspectives, school safety, and COVID-19. So historically, school violence research and intervention has really focused on students and has excluded adults. And this led the American Psychological Association to pull together a task force back in 2008. And I was a member of this, and it's a national task force, and it was led by Dr. Dorothy Espelage, University of North Carolina at Chapel Hill. And we conducted a national study of over 3,000 teachers. And what we found is that there are actually alarmingly high rates of violence and aggression directed towards educators. About 80% of teachers had experienced violence or aggression in the current or previous year. And one might think, well, this is all, from students, but it's actually a mix. There is a large student percentage, but also parents, colleagues, and administrators sort of aggress towards teachers. And teachers also talked about ineffective policies and practices, and they were pretty stressed out about lack of administrative support, and that was somewhat common among our sample. So in 2019, we developed a new task force that I'm sort of in chair of, and we are building on the previous work that we did that was just focused on teachers. And now we're focusing on pre-K through 12th grade educators, but also administrative leaders, school psychologists, school social workers, paraprofessionals, and other school staff. We've also broadened our collaborations with national organizations that are focused on education and administrative leadership and school psychology and school social work. And we developed a survey that we're distributing nationally and looking at violence and aggression pre-COVID and since COVID, COVID-19 concerns regarding reopening, school climate, effectiveness of school practices and policies, family, neighborhood, and community influences, and recommendations. So what do we find? This is just a snapshot. We're not finished. We're still in the mode of collecting data, but this is based on close to 9,000 participants in various roles. You can see we have about 6,000 teachers and almost 2,000 school staff from various roles, and some psychologists, social workers, and administrators. The school settings, we have a mix of rural, urban, and suburban. And then in terms of race, we have about 81% white. We also have 79% female, 45 years of experience, and 45 years of age and about 14 years of experience. And this is, these demographics for race and experience and gender are roughly consistent with the national distribution within the US. So because, people are in various modes, this is just a snapshot of a little over half are teaching in hybrid, some hybrid mode, some online and some in person. And these are their concerns. I'm going to present about 3 slides about what their perspectives are. And what you can see is that the people are sort of saying that these are moderate or high concerns. So of that roughly 8,800 people, you can see it's about 65% have moderate or high concerns about their personal or family health in terms of reopening. A lot of, close to 60% have concerns about their ability to do their jobs. And there's also, over 70%, close to 75% are really concerned about students' health and student academics. So related to student concerns prior to and since COVID-19, so this chart is showing that people who sort of said this is a moderate or severe problem, and the dark blue is prior to COVID-19, and the striped blue is since COVID-19. And as you can see, we have harassment and bullying, verbal aggression, disruptive student behavior, student mental health, and student substance use. And there's, I think, a few messages is that some of the behavioral issues have gone down, which makes sense because we have a lot of hybrid and online things going on. So there is less aggression towards educators. But what has gone way up is sort of concerns about student mental health and student substance use. So these are, but not just to look at the change, but also to look at sort of the overarching values that these are pretty high numbers to be moderate or severe problem, whether pre-COVID or since COVID. So when you're talking about, 60% in terms of student mental health, but even if we're sort of looking at the number of concerns and the severity of the concerns, it's pretty significant. Okay, and then this is the last slide about the results. Here's some other issues that we're kind of looking at and related to discipline, because this is one of the big themes that has kind of come up in our research. And again, as you can see, the red is prior to COVID-19 and the striped boxes are since COVID-19. And these are about agreeing or strongly agreeing that these issues are a problem. So what you can see is, again, sort of decrease in some of the behavioral issues, but pretty high numbers across the board. So you can see that almost, around 50% of educators are worried about discipline being effective and fair. So these are, I would say, high numbers of problems that we need to pay attention to, but also show patterns pre and since COVID. Okay, so just some highlights for the group. And we have, so top concerns, personal and family health, ability to teach effectively, student mental health and academic progress, and effective and fair discipline. Some of the decreasing concerns around student aggression and classroom and behavioral management, and heightened concerns around student mental health and student substance use. Okay, so in terms of implications, practice and policy, recognizing the importance of student behavior, mental health and substance use in schools, providing resources and implementing effective training and interventions to address them. And if we sort of notice about student mental health and substance use, that in all likelihood, when we go back to fully in-person kind of teaching, behavior problems are also going to increase and probably become even worse than they were pre-COVID because of all of these additional problems and stress that we have in students, as well as staff. And then in terms of policy, ensuring that education professionals have a voice in school decisions and policies kind of across different roles, and setting clear and fair discipline policies and consistently implementing these policies. So that's going to wrap it up. So thank you. Thanks very much to all the educators who took part in the survey, and as well as to our National Task Force, to APA, to my students. And we also have an APA website that has a bunch of references here, and here's a few others. I'm going to stop sharing my screen now. And move on to our next presenter. So we have Dr. Joanna Buscemi, and she is an assistant professor in psychology at DePaul in clinical and child psychology. And she's going to be talking about health policy advocacy during and beyond COVID-19.
Thank you all so much. I'm so happy to be here to talk about something I'm really passionate about, which is health policy advocacy. And I've had the honor and privilege of serving as the chair of the Health Policy Council for the Society of Behavioral Medicine for the last couple of years. And before that, the chair of the committee. So in my current role, I oversee and sort of organize all of the health policy advocacy of the organization. There are two main ways in which we advocate for our science. One is through health policy position statements, and the other is through direct health policy advocacy with legislative staff. And so I wanted to sort of break it down and talk about both of these. So we realized within our organization that when COVID hit, that we really needed to start making statements about COVID-19, and we needed to start figuring out how to focus our policy agenda in that direction because so many different policy issues came up. So the health policy position statements are developed and disseminated through our committee, which is overseen by the council that I chair. And we have a really great infrastructure for members to develop these statements. We train them, we give them feedback, and then we disseminate them widely through SBM channels, through partnerships with other like-minded organizations, and through delivering the messages and the recommendations directly to legislative staff. When I started as council chair, I had the honor of developing a health policy ambassador program. And what we do is we train members to basically develop relationships with legislative staff on key issues. So I'm going to talk about both of these briefly. First, I want to give you some examples of position statements we've put out related to COVID-19. And again, the whole point of this is to really relay our science to policymakers because they don't have it in their hands the way we do. And it's our responsibility to relay that information and to make sure that our science has impact. So one of the statements we put out was about COVID-19 and rural health, because we know rural populations have been hit especially hard by COVID-19. And our recommendations in this statement were really connected to increasing broadband access so that individuals in rural areas could receive telehealth, and also making sure that telehealth visits are reimbursed at the same rate as in-person visits to really help those rural populations get the care that they need. Another issue we focused on was mental health, increasing access to mental health services more generally, particularly to mitigate family stress that's increased significantly in the COVID-19 pandemic. And the last one that I want to just bring so that you have an idea of the types of statements we talk about, the last one I want to bring to your attention is one that we wrote about increasing diet quality through the pandemic and beyond through government-funded nutrition assistance programs like SNAP and school meals. And this one is really important because we know that we've had a huge increase in food insecurity in the face of the pandemic. And we put out a statement before this talking about reducing food insecurity. And then this was our follow-up to say, we don't just need to focus on quantity, but we also need to focus on dietary quality in these meals that are getting served to lower income and vulnerable populations who've been systemically impacted by oppression. So this one was especially exciting because one of my ambassador teams developed this statement and then they shared it directly with their policymakers that they're building relationships with. So we've also had a number of other COVID-19 related statements that are on our website, including policies that can mitigate in-home violence during the pandemic and equitable healthcare during the pandemic, just to name a few others. I mentioned that I've over the last year or so been developing a health policy ambassador program. And the idea is for these ambassadors to really develop direct relationships and facilitate two-way communication with lawmakers. So we're educating them, and then we're asking, what can we do for you? What science do you need us to deliver directly to you? The council that I chair really helps to train these members and to oversee the whole program to make sure it's running smoothly. And like I said, it's really, we want it to be both ways. We don't want to just pop in and ask them to do a bunch of things for us. We want to also see what science we can provide for them as well. Some of the types of communication that the program was developed to initiate would be actually visiting policymakers either in their districts or in their DC offices. That has become virtual, obviously, with the pandemic. Sending emails monthly with links to research that are related to key priority areas, tagging them in social media posts to share our science. And also, eventually, we want to be able to invite the policymakers and staffers into our labs to learn about the work that we're doing. The 3 priority areas that our organization has chosen to chase over the next 2 to 3 years are listed here. So the first one is about combating opioid misuse. The second one is really focusing on the healthcare needs of rural populations. And the third one is about child nutrition. And so these are the issues that we've been focusing on. They were developed before the pandemic. When the pandemic hit, I had a panic. I didn't know exactly how to adjust things. And then I realized, no, the pandemic is actually impacting all 3 of these areas. So it's very clear where we need to go from here. So over the past year, we've focused our talking points around expanding and extending telehealth coverage through CMS, expanding telehealth access in general, and also expanding funding for nutrition assistance programs. And we've been developing relationships with policymakers around these issues and around these talking points. The stars indicate where our current ambassadors reside. So we're trying to expand the program, but this is what the map looks like at this phase. And we're really hoping to sort of fill some gaps, particularly in Middle America, but you can see where we have representation. So there's 14 ambassadors. We're about to train 10 more. And we have 11 states and 16 legislators that we're building relationships with. I include this example because I want to show you what can come out of these meetings. This was an email from one of our ambassadors that shared with us that she had a call with 2 congressional aides for Senator Markey, and they were really excited about the work we're doing. And for Massachusetts, this was in the fall, but telehealth coverage was going to end. And because of the meeting that she had, they said they put together a bill to allow for the extension of telehealth coverage, video and phone, at a reimbursement rate similar to the in-person visits. So a direct result of the meeting that the ambassador had with the legislative staff resulted in a collaborative effort to develop a bill to extend telehealth coverage. So these are the wins that we get really excited about in our organization. This is just the beginning of our ambassador program, but we are working on engaging like-minded organizations so we can partner in our efforts. We're also facilitating next steps for each next subsequent visit that our ambassadors have with the legislative staff. We provide that ongoing support so that if a legislative staffer asks them a question, we can provide the answer from our science. And then we're expanding the program. Thank you so much.
Okay, thank you, Joanna. And our next speaker will be Nicholas Carruth, and he is a graduate student in our Industrial Organizational Psychology program at DePaul.
All right, so thanks, Susan. So as a part of my master's thesis research, I'm looking at how workers have adjusted to working in remote contexts and scenarios during the COVID-19 pandemic. So I'm still in the process of collecting data for this project, but I'm about halfway there. One of the differences about working remotely during the pandemic is that workers have really been forced into these scenarios where previously remote work was really kind of a choice a lot of the time. And so in fact, about 40% of the United States labor force has been estimated to be working remotely at this time, with little or no time to prepare for moving into these remote working scenarios. So apart from issues such as physical and mental health issues that are prevalent amidst the pandemic, we might also see things like merging of work and family lives and perhaps issues associated with those dynamics at home. So I've administered a survey to about 100 remote workers in the US. Again, I'm hoping to double that number. And it consists of 70 females, 20 males with an average age of 37 years old. And when we ask people questions about what are some barriers you've experienced since you've transitioned into a remote working role at home? Overwhelmingly, people are responding to this item about family interruptions being a big challenge in the work from home scenario. Even more so than concern about COVID, access to technology, internet issues, some of these other things. And people were allowed to respond to more than one of these on this question. Similarly, we provided a number of statements to people about different plausible challenges that they might be experiencing during working from home. And this item in particular stood out, the statement, "I'm having trouble separating personal time from work time." About 60% of the sample responded with either agree or strongly agree to this item, that they're having trouble separating, dealing with personal and work time conflict. So looking at a couple of outcomes I have in this research, one is just psychological well-being. So we asked people about their psychological well-being over the past couple of months during the pandemic. And looking at some relationships between this and other variables, these are just correlations, but work to family conflict, what has to do with work spilling over into the family domain and causing conflict in the family domain, was related to psychological well-being. Segmentation preferences, this is people who prefer high segmentation between work and home life. Not surprisingly, experiencing reduced well-being at this time. And we looked at a number of individual differences, one of which was trait mindfulness. And for some reason, this variable is popping out as a correlate of a number of the outcomes I looked at. And some have argued that this might be because people who have cultivated some amount of mindfulness or awareness are more able to decide when to detach from the work and home life domains. So you can be more present with your family or with your work life and vice versa. Another outcome I've looked at is change in job satisfaction from pre-pandemic until now. And the high end of the scale was I'm much more satisfied with my job since the pandemic, and the lower end was I'm much less satisfied. And similarly, work to family conflict was associated with this. So people experiencing a high level of work to family conflict are much less satisfied with their jobs than previously before the pandemic. Here also, we're seeing that family to work conflict, which is family spilling over into the work domain, is associated with less job satisfaction since the pandemic started. Segmentation preferences again, so people who prefer segmentation from between work and home life are experiencing less job satisfaction. And again, trait mindfulness was another variable that stuck out here. So talking about how mindful people are and attentive to the present moment. Okay, I'm going to skip these next slides. And so unfortunately, I haven't been able to test some of the more interesting questions that I'm interested in answering because I'm still collecting data. But some of the takeaways from this thus far, so for remote workers during COVID-19, managing the work and family domain seems to be of particular importance and a particular challenge. And specifically, work to family conflict. So people seem to be more affected by work spilling over into their family domain and interfering with their family lives than vice versa, than family interfering with their work lives. So some questions we might ask are, what can organizations do to alleviate some of these issues for workers? And particularly people who prefer segmentation between home and work life, who haven't had the choice of whether they want to work at home or in the office, who've been forced into these remote working scenarios. What are some ways in which organizations could help these individuals better adjust to working remotely? And I'll explore some further potential interactions or moderators between some of these relationships as I collect more data. And just overall, what are some ways in which remote workers' experiences might be improved? So I will stop there.
Thank you, Nicholas. And our next speaker will be Dr. Yasmin Moydeen, and she is an alumni of our psychology doctoral program. She's a clinical child psychologist, and she's also president-elect for the Minnesota Psychological Association.
Thanks, Susan. So in contrast to what the rest of you have presented, your excellent research, I'm just talking from the field. I am a clinical psychologist in Minnesota. I graduated from the doctoral program at DePaul in clinical child psych in 1995. I've been in Minnesota since 1993. So I just want to tell you a little bit as a practicing clinician, what it's been like. So first of all, let's just start with APA did a Stress in America survey. A Harris poll was completed on behalf of APA in the during November of 2021, adults 18 and older. And they found that 84% of respondents, about 2,000 people responded, 84% reported some sort of feelings like anxiety, anger, feeling scared, unsafe. And if we look at overall rates of depression, which is the lower dotted line, and anxiety right here, and then this is mixed. We notice that anxiety is higher than depression. This is between August of 2020 and February of 2021. As a result of COVID-19, what needed to happen was trying to figure out how we're going to end up seeing people since we couldn't see them in person, which resulted in emergency approval of telehealth services. So prior to this emergency approval, there were very strict guidelines about how this could be done. This could only be done via certain HIPAA compliant platforms and only in certain conditions. And the reimbursement rates were actually quite hard to figure out. They were going to be lower than in-person rates. So we did receive this approval, and you can see here that the way it changed is that we did not have approval just for these HIPAA compliant platforms, but for platforms like FaceTime, Facebook Messenger, Google Hangouts, Zoom. They created a HIPAA compliant Zoom platform. And being out, I worked in 2 different agencies during the pandemic, and this was definitely so helpful because I started out using Microsoft Teams, for example, and especially early on in the pandemic, clients didn't know what Microsoft Teams was, and we needed to send out the links. People didn't know how to do that. They may have been more familiar with just what FaceTime was or Skype. Over time, people got more familiar with Zoom. So a lot of the challenge with clients was trying to figure out how to get them on the formats and having the availability of different formats. For example, if Teams didn't work and they had an iPhone, for example, I could jump on with that and still be able to complete a session. What we found was that between March of 2019 and March of 2020, there was a 154% increase in the use of telehealth. Not surprising. Over time, we were able to figure out how to have some in-person visits when it seemed that telehealth did not make sense to do. So telehealth has been amazing. It has decreased so many hurdles to access for services. You did not have to deal with the hassles of parking, for example, or leaving your workplace and commute to your appointment. You didn't have to hang out in the waiting room of the office, which then decreased any privacy or stigma issues. By increased access, what I mean is we were no longer restricted to a particular catchment area. We were able to see people across all parts of the state. There are some concerns about accessing services across state lines, and this is an insurance contractual issue. And for clients, it doesn't seem to make sense. If they were to try and get away from their home and take a 2-week vacation in California, let's say, and they popped on your Zoom call from California and you had to then explain to them that you could not see them. These were the types of hurdles that we were dealing with. So you can see someone, FYI, in a different state than where you lived or where your license is. if there was an emergent issue, suicidal concerns, etc. Other than that, we could not. And this also, telehealth drastically decreased no-show rates for populations where, clinic populations where we would see very high no-show rates, it just dropped. Disadvantages. This is very hard to do with little kids, and for kids on the autism spectrum, especially in the severe range. It can already be difficult to forge a connection and engagement during a session, and the use of things like toys, etc., is really what engages kids. You can observe them better in that way. Telehealth took all of that away. So while we were able to observe them, keeping them engaged and knowing how to do this with children was a challenge. People with disabilities also harder to, I should say different abilities, harder to engage. People without Wi-Fi access or drops in Wi-Fi were an issue. Elderly populations, the concern is how to navigate some of these technologies, and which left us with needing to know how to do audio only. So Nicholas's talk was interesting because of the remote work issue. For mental health clinicians, it's been tough. So amazing that we've been able to do our work from home, and all of this was very unclear at the start of the pandemic. We didn't know if we would have jobs, and it has been the opposite. And there are pros and cons here. There's been an incredible increase in hiring. There's been an incredible increase in burnout. Obviously, most of us have been working from home. So the concern at this point is, what's the future of telehealth going to be? Will there continue to be reimbursement for telehealth on par with in-person visits? And APA is working to ensure that. I wanted to tell you just briefly about some of the other advantages. Through Vanderbilt University, prior to the pandemic, they developed this protocol to use telehealth to do a brief screening, if you will, for symptoms of autism. The test that we tend to use is called the ADOS, the Autism Diagnostic Observation Schedule, lots of manipulatives, and you couldn't use it, obviously, via telehealth. There are certain very structured observations. And so COVID presented a very big hurdle in terms of, are we going to have we'd had a decrease in testing because we couldn't do this in person. But this really wonderful protocol instructed us to have parents and children have certain toys that they already have, and we would instruct parents to engage with their kids in certain ways or ignore their kids to see what the response was and rate what the observation was. Somehow similar to what we would do in person, but I was very much amazed that we were still able to assess for autism in young kids, which really is important because getting early intervention services is crucial. And I was worried about the effect of the pandemic on this type of assessment. And we were also able to see clients across the state where prior they would have to travel 5 hours, stay overnight, etc. And this decreased all of that. I just want to tell you a little bit about where I'm at and what our experience is. I'm at a clinic called the Lorenz Clinic. We're in the South Metro. This is where you guys are. Whoops. This is where you guys are in Chicago. And I'm like here. And our offices are kind of like right around here. And over the past year, we've had an increase in visits by about 30%. We've expanded our locations to now 5 locations. When I started, I've been at this clinic since November. We're in the end of May. I started with 66 employees. We have over 100 employees now. We've expanded our training program, our med management program. Our wait list is incredible. It's high. We have a very high wait list, and we've increased our catchment. We've increased where we see our clients. So not just in that little area that I told you about, but really across the state. And I think that's all I wanted to share. I'm going to turn it back to you, Susan.
Okay, great. So we have one more person that's going to start us off with our discussion. That's Dr. Linda Degutis, and she's a lecturer in public health at Yale University. And go ahead, Linda, and then we're going to open it up for questions.
Okay, great. Thanks. These presentations are all very interesting, and there were some common, I think, some common themes or threads woven through them. And what I think is really crucial and really important to think about in all of this is we often, at least, you know, in public health and other places, we talk about what we do during a disaster or a public health emergency, what lessons we learn. And I always say sometimes it's the lessons we didn't learn. We just go lessons not learned because we don't use those to change the way we react to things or change the way we do things afterwards, after the emergency is over or done with. So I guess one of the things I would really say is important is looking at the research and the work experience that everybody's having and figuring out how is that going to make things different in the future as opposed to going back to exactly the way it was. You know, a lot of people say we just need to get back to the way we were, but I think much as, you know, crisis theory would tell us, you try to get back to a higher level than what you were before the crisis occurred. So I think that's one piece. The other thing that I see going through all of this too is the number of policy implications that there are from each of the presentations and the work that everybody's doing. We're hearing, you know, we had people working from home or teleworking before the pandemic, and everybody thought, oh, here's a way to save space in offices. Here's a way to decrease the need for physical space in many places. But you know, the other challenges that people face, certainly with family and conflicts, partly because kids were getting schooled at home, or, you know, they were also home. The whole family was home. Those were a bit, you know, those were a bit different than the usual teleworking, perhaps. But I still think it's going to be very important to find out how people need to adjust if they are working from home or teleworking, you know, in the future, and what are the options? What are the kinds of things that, you know, that we need to do? I think that the advocacy, health policy advocacy options, this program that, you know, that this health behaviors group has put together, the Society for Health Behavior has put together is great. And I wish more groups would be doing that, to talk about the science and bring the science to the legislators. And I think that's going to be another critical piece of all of this, is really getting the science translated so that the legislators can really understand what it means. You may have seen the proposal now that's come from the president for public health, where it's increasing the funding for public health, but it's, you know, increasing the number of people you can hire. It's not looking at doing things necessarily differently, which, you know, public health has been underfunded and everything, but it's sort of doing the same thing that we've been doing, just spending more money on it, perhaps. So I think those are the things that we should all be working on, trying to figure out, and how to get that across to the public and to the policymakers. So so I'd say it's going to be important to learn the lessons, and that's what will help bring us back to a better place than we were to begin with. So I'll turn it over to Lenny for the questions, Q&A.
Thank you so much, Linda. And at this point, we're going to throw things open to our audience. If you happen to have any questions in general or for any of the panel members, you can just send them to us by chat, and I can then read them off and allow other people to get a chance to kind of think about some of the issues. And maybe I can just start things off as people are thinking about their questions is, we've talked about psychology as being something incredibly useful for all of us in our work. I'm wondering, let me ask the panel members, is anybody using psychology for themselves in a sense to sort of deal with this pandemic, which truthfully is about the worst thing that's happened to our country since 1918, Spanish flu pandemic?
I can talk. I sure try. I do. It turns out it's a lot easier to deliver a treatment to somebody else than to deliver it to yourself. But I think the things that have been especially helpful for me have been behavioral activation. So sort of like motivating myself to get out every day despite what's going on and do things that I enjoy. And then probably some reframing, because even though things can seem very difficult day to day, I know that I'm incredibly fortunate and having sort of a constant reframing battle with myself about, things can be tough right now and I can be pretty fortunate, and those two things can happen at the same time.
Great, thanks for sharing.
Yeah, I'll piggyback on what Joanna said. I think it is a lot easier to provide the advice than to heed it. You can ask my family, they would say that. I feel like definitely going out of the house for drives was useful because it reminded me that the world still existed. And very early on in the pandemic, the drives, there were just, you guys probably saw there were no cars there, and it was weird, it was scary. And I think that's one of the things that helped me with just putting things in perspective, is literally getting out of the house and driving around so I could see what the rest of the world was doing, and to see other human beings around was helpful for me spiritually.
I think that one of the things that's happened is that, and Nicholas kind of, talked about this a little bit, the idea that, sort of your workday becomes so much longer. There used to be, there used to be more definition between going to work and coming home, and now you can just get up and start working and then work until you go to bed if you want to. So figuring out, it's a new challenge, I think, in terms of figuring out a work-life balance that is not easy, as others have said.
Yeah, I would agree. I think boundaries, at least for me personally, have been really important and hard to stay on top of at times. You hear people complain a lot, at least anecdotally, about I have such a hard time shutting work down when I'm at home, turning off the email, shutting my computer down for the night. So for me personally, I've really had to practice maintaining good habits in those forms of shutting things down, moving into my personal life at a certain time. And that's, both in a psychological sense, but also in a physical sense. I think, like Yasmin pointed out, creating a space where you can work that's distinct from the rest of your house. People are finding that really useful. And if you think about something like role theory, we're used to taking on these different identities throughout the day, whether that's at work or home life or commuting even, or being out in the world. So I think creating these separations has been really useful for me, but not easier said than done, I guess.
Well, thanks for sharing some of your, we as psychologists, use these same strategies that we talked to other people about. But this has been a particularly excruciating time because it's not just a kind of viral pandemic that we're dealing with. There's also incredible violence, racial issues, an insurrection in our capital, which has added, even greater difficulties. And I'm wondering how people have, in a sense, just dealt with the combination of all these things happening, either for themselves personally, with their families, or with the individuals they associate with, either in community settings or their classes.
I'd love to speak to that. So again, from Minnesota, and obviously this is where George Floyd's murder took place. So I've been thinking so much about this because in order to really understand it, as Minnesotans, we've needed to figure out the history of race relations here, and the topic of Minnesota Nice comes up. So Minnesota Nice is, we are known to be very friendly and polite, but not necessarily to get to know our neighbors very well. And I think people that have been from Minnesota historically have stuck to their own groups, their own families, friends from high school, but not reached out. So on the one hand, we would invite refugee populations in, but not really get to know them. What the pandemic did was it further exaggerated the Minnesota Nice in some ways, to the point where it was catastrophic, and you could no longer be polite and quiet. It took all of that, I think, for people to grapple with what's been going on. So I think it exacerbated the racial disparities that we already have in Minnesota in healthcare and education and housing, and it forced us to have conversations with each other. It's been hard. It's been very hard.
Thank you, Yasmin, for sharing, and particularly with your experience in your state, where it has been really the focus. We do have a question from one of our viewers, so I'd like to throw that out and sort of see who might want to try tackling that. What is the best advice for someone with family issues that have to stay with their family in the whole time this pandemic? What is the better choice to do? And that's from Petrie and So thank you, Petrie, for asking that. And what is this advice for someone with family issues that has to stay with their family the whole time? And are there other choices? Anybody want to try to tackle that question?
I'll jump in, but I don't want to monopolize it. I think it really depends on the type of family issues we're talking about. One thing that we've noticed during the pandemic is an increase in domestic violence. So if we're talking about that and there are safety issues, we would handle that in a much different way, in terms of finding safe places outside of the home and accessing domestic violence resources. If we're talking on the other end of that spectrum in terms of an increase in family conflict, because you have to stay with people that perhaps there's already some tension, I think the pandemic can lead you to believe that there are no choices but to stay inside the house all the time. And probably I would think about accessing other resources, either through telehealth, through therapy, for example, or friends or family via other platforms, and as well as being able to get outside of the house. Sometimes that can really loosen up and decrease some of that tension.
Thank you, Yasmin. Any other kind of reactions to that question?
She answered it so well that I have nothing to add.
Okay, sounds good. We've got something that Molly has posted. Learn more about 10 years of CSH. So we've got a a nice link there for people. So we're kind of quickly getting to the end of our hour. We really have maybe just a couple minutes to maybe just think about this panel. I want to just create some space for people on the panel. And if you have a final thought that you want to comment concerning either what this panel has meant for you, what the COVID crisis has meant for you, what we have been able to contribute as psychologists, let me just kind of go around and give everyone just a last summing up so that we can just have some closure. So maybe I can start with Susan and give her a chance to just reflect on this last hour.
Sure. Well, I really appreciate people coming together and sharing their different expertise. I think it's been a kind of a nice balance of all these different perspectives, from more clinical perspectives to research to policy, and thinking about really sort of public health. As we know, this is like an unprecedented time in our world. And I think psychology has a tremendous amount to offer in terms of sort of, all of these different domains. And we've just kind of gotten into a little smattering of it, but I really enjoyed kind of learning about others on the panel work and putting it together. And I think it's really good to have ongoing conversations, because I think, as Yasmin was talking a little bit about, it's not just the pandemic, but, sort of really there's all these crises kind of layered on top of one another. And I think it's, sort of really escalated challenges around many things around health and race relations, and that we need to talk to one another and try to put our best foot forward in terms of research practice and policy.
Great. Thank you, Susan. And we also want to thank you for really being the person who's with the dean has put all these programs together for this 10th year's celebration of the college. So thank you so much. Yasmin, any reflections that you have of this last hour or of what's been going on with you?
Sure. Well, I loved reconnecting with DePaul in this way. It's really wonderful for me it's kind of full circle. It's nice. I think my only thoughts in reflecting on the pandemic is, thank goodness it feels like it's wrapping itself up. This has been very, very difficult. And I think we've learned some important lessons about how to increase access to mental health care that I don't think we should go backwards. I think there's some important lessons learned that we need to carry forward.
And again, thank you so much, Yasmin, for coming back to DePaul virtually after so many years. One of our wonderful graduates. Linda, how about yourself? Any reflections you want to make?
Sure. I think that we've not always talked as much about some of the sort of mental health and psychological issues that people face in any kind of emergency or disaster situation. And certainly, the whole issue of violence that's been occurring and how people have reacted to one another, how much violence there has been in so many places. I'm in Atlanta, and every morning I just dread looking to see how many people died overnight or from violence. And we've had, I think, 7 people now killed on the highways just being shot as they're driving their car, that kind of thing. And it's really a difficult situation here, and it's happening all over the country, certainly, but we're seeing all this road violence that's incredible. And so I think we all have to figure out how to be better at interacting, and how to really be better at taking care of the people around us, and caring for them during any kind of situation.
Great. Well, thank you so much. And thank you for contributing as a discussant and for all the contributions you continue to make to DePaul and also your extremely distinguished career.
Thanks.
Joanna, do you want to give any final thoughts?
Sure. I just want to echo what Yasmin said about the flexibility. Like I'm trying to, and I'm going to go back to my thing about reframing, where I do think like one thing about things feeling like one potential flip side of everything feeling like it's crumbling and falling apart is that we've had to be creative about solutions that are really going to help people even beyond this pandemic. And I see that a lot in the policy space, where these policies are very flexible that have been developed, and it seems like a no-brainer that we should move them into the future. So if something good's going to come out of it, I hope that it's long-term policy solutions that help combat inequities.
Great, and thank you so much, Joanna. It's just really extremely important work that you're doing, and so great to have the policy front and center with all the work that you do. And Nicholas, any last comments you might have?
Yeah, so thanks everyone for being here, and as to the other panelists as well. I guess to maybe end on perhaps a more like an optimistic remark, I would say I think in psychology, this pandemic has really sparked kind of a wave of interest and research in doing more applied and sort of societally relevant research and tying our theory to societally relevant phenomenon. And so I hope that continues. To echo Linda's point, I hope that we can continue to sort of have that energy and focus and spark of excitement in terms of applying what we do to real world issues and scenarios. And I hope that what we've learned from this is not something that we just sort of forget about, but something we continue to pursue and apply in the best ways that we can. So I'd say that.
Right. And so thank you for coming on as a grad student. And again, the research that you're really doing is fantastic. So thank you so much. Let me close by just posting. We've got a posting from Monica Reddy, who I think just sums it up so nicely. So I'll just read. She says, "Thanks to you all for insight into both your research and practice with COVID-19. It's wonderful to catch up and see how everyone in psychology has been contributing, making change and coming together, especially during a time that feels particularly isolating. Hoping to see some of you on campus in the coming year." Thank you so much for that comment. You actually could have been a panelist. And let me just say that this has been a terrific panel, and I wish you all the best. And let's continue celebrating the 10th year anniversary. Bye-bye now.
Bye-bye. Thank you.
Bye.
Yeah.